held the first informal meeting of defense ministers done by video conference. And we discussed the defense implication of the coronavirus pandemic and the answer that we can do from the military capacities of the member states. We have been focusing on two pressing issues. First, military assistance to face the crisis and the situation in the EU missions and operations that we have in the framework of the common security and defense policy. Along this meeting, that lasted 3 hours, defense ministers shared remarkable examples of how our European armed forces are contributing to the efforts to counter the coronavirus crisis. From many aspects, they are doing a remarkable contribution. They are providing transport and logistic support, building hospitals in record time, deploying their medical staff, supporting the police and other national services. As a Spaniard, I am very well placed because the Spanish army is doing an incredible effort in order to help the civil services to fight the pandemic. But same thing in other countries, especially for sure where the pandemic is hitting stronger the society. In Italy, the Minister of Defense made 7,000 beds available for citizens who have to undergo a special medical surveillance, as well as medical staff support. In Germany, 15,000 soldiers support the national efforts against the pandemic. In Poland, 9,000 military personnel are currently involved in different activities related to the epidemics, with armed forces providing several dozen sanitary vehicles and mobile medical teams. The Swedish Armed Force has established around 50 intensive care units and around 90 medical sites. In Lithuania, the Strategic Communication Department of the Lithuanian Armed Force has started conducting analysis of information attacks related to coronavirus. It has been an incredible set of examples coming from the 27 member states. There are just examples, but these efforts are not only conducted at the national level. Military planes have helped to repatriate European Union citizens stranded abroad. They have carried patients from one country to the other. They have delivered equipment. For instance, the military of Czechia has delivered equipment to Italy and Spain, and the French Operation Resilience has produced quite an important move of patients evacuated from the hospital from France to Germany and Switzerland. Romanian armed forces have transported 90 tons of medical equipment and supplies from the Republic of Korea. All these works are crucial, and for this reason, we agreed with the ministers to explore how we could use the military expertise at EU level to support exchange of information and sharing of best practices among member states. And to do so, we could set up a task force within the European External Action Service led by the European Union military staff. This will be done in full compliance, in full coordination and complementarity with NATO. I can assure you there will not be duplication of work. But it is important that we, Europeans, we work together to ensure a coordination effort and a mutual support where is needed, in full solidarity. In the current situation, as I said several times, we are also facing a kind of infodemic. It's a toxic process that brings to the public a lot of fake news and wrong information, and it is important to remind that Europeans stand together to fight against the crisis. The second point we have been talking about and discussing about is the impact of the coronavirus pandemic on our European Union common security and defense missions and operations. Let me remind you that we have 17 military and civilian missions and operations around the world. The most recent one is Operation Irini, which is going to be deployed in the central Mediterranean. But we have also missions and operations in Eastern Europe, in the Western Balkans, in Somalia, in the Sahel. And today we focus in particular on our 6 military missions and operations. Obviously, health and safety of our personnel remains a primary consideration. And we have put in place a number of measures to protect our staff, and we are following the containment measures adopted by the national authorities. At the same time, we are making sure that our missions and operations maintains a presence on the ground and continues to conduct their activities as much as it is possible to avoid a negative security impact. The countries and the regions where these missions are deployed are already fragile and affected by instability. And I'm afraid the pandemic is only going to increase this situation. This is why it is important that we remain engaged and maintain our support. Even if maybe we should reduce the number of staff in some missions, but we will need to find a smart way to continue to support our partners while adapting to the circumstances on the several and different missions. We will explore ways to help host nations to tackle the pandemic and improve their resilience. And we will act in a coordinated way, avoiding any kind of unilateral decision by any member states engaged on participating on these operations and missions. This has been a strong commitment, and I thank all member states for it. About Operation Irini, we all agreed that this launch last week was an important achievement, and that now it is essential to ensure the operation will have the means and needs to implement effectively its mandate. And finally, we agreed also on the crisis offers an opportunity to reflect on how we can improve our resilience and use defense initiative to develop defense capabilities required to address similar situations in the future. We agreed that ongoing work in security and defense remains a clear priority, now perhaps more than ever, because from now on, health becomes a security issue.